Welcome back, America, to your Caribou Data Science channel. Today is welcome back, America, to your Caribou Data Science channel. Again, I want to emphasize the word your Caribou Data Science channel, our Caribou Data Science channel. This is about you. Okay, this is about giving you the data you need to understand, to understand the world about you. Whether it's COVID-19 or sickle cell anemia, I'm here to give you the data that you need for COVID-19, okay, America. Before we get started, hey, don't forget to click that subscribe button. Don't forget to click the share button. And don't forget to click the share button. Click on the share the video on Facebook and Twitter. You can, of course, also copy and paste the link to the video into into an email or text message and share it with your friends and family that way, okay? I know there's more than 0 people out there who are interested in the plain, simple data of COVID-19 for the U.S., okay? One other note before we get started, I'm actually decided to go to a 12-month rolling report, meaning I'm only reporting the data for the previous 12 months. In actual fact, probably only the previous 6 months is really all it matters, because what happened a year ago, January 2020 or March of 2020 really isn't that important right now. I remind ourselves that Washington University's Institute for Health Metrics and Evaluation say the single best measure of a pandemic, of a spread of a pandemic, a disease, is daily deaths. Not, in other words, it's not hospital beds. It's not daily cases. Okay. And once again, we got all so don't be misled by the liberal news media, who are only reporting the most negative reports they can find on COVID-19. Okay. The latest drum they're beating is, of course, the variant, the COVID-19 variant, uh, uh, variants diseases, the mutated COVID-19 strains. Okay, don't be misled by that. All right, let's go ahead and get started now. Okay, America, again, as I remind you here, this data goes back to July 1st, 2020. 31 for the previous 2 months, we've had 31,584 cases, 432,000 deaths. A declining mortality rate means that the ratio of cases to death is increasing. And you can see we are seeing a bit of a climb back up here in cases. You can see on July the 16th, the report 79,310 cases. But on July the 17th, that number dropped back down to 12,960 cases and back up again. So but for the 7-day moving average, as of July the 14th, was 31,557. That's probably a better measure of the average number of daily cases, okay, in the U.S. right now. What about this? Well, here's the good news. We're continuing to see a decline in cases, in deaths. For July the 21st, 333 deaths. For the 7-day period ending July the 14th, we can see we had 253.8 cases, okay? Deaths, I'm sorry. For the 7-day period ending July the 14th, we were averaging 253 deaths per day, all right? Here's the weekly case. You can see we got this 3-week increase here in weekly cases, but deaths are continuing to look good, okay? But nonetheless, look, 1, 2, 3, 4, 5, 6, 7 months in a row now, our cases have finished below this spike right here. Okay? Deaths, 1, 2, 3, 4, 5, 6. We're going to have 6 months in a row now when we've seen a decline in COVID-19 deaths in the U.S. What this shows is here, this is the number of cases per 100,000 people in the US. Well, this number is around 12 here. So on average, I'm saying about 12 to 13 people out of 100,000 have COVID-19 right now. This is the number of people out of 100,000 are dying from COVID-19. Well, you can see here, this is 1/2 person, this is a 1/4 person. So what we can say is right now, in the US, less than 1/4 of a person out of 100,000 is dying from COVID-19 in America right now, okay? These are cumulative totals. What we're looking for here is a flattening of this curve, okay? There is a bit of a flattening, but not a really big flattening, and a bit of a flattening here also, okay? Now, if the cases of this start to go back up, well, guess what? We're going to lose the flattening right here, okay? So that does conclude your report for today. I want to thank you so much for stopping by. Hey, don't forget to click that share button, share the video on Facebook and Twitter. Also, copy and paste the link to this video into your email and text message and share it with your friends and family that way. Thanks so much, America. We'll catch you tomorrow with an updated report.